Hello. Welcome to my channel. In this video we will talk about breast cancer. Learn about breast cancer in detail. The early signs of breast cancer include the following. Types and stages of breast cancer. What are the stages of breast cancer? Learn about breast cancer in detail. Breast cancer is the most common malignancy in women, and the second leading cause of death from cancer. The chance of dying from breast cancer is about 1 in 33. However, the death rate from breast cancer is declining. This decrease may be the result of early detection and improved treatment. Breast cancer is not only a disease for women. As 1,600 men contract the disease annually and about 400 may die from the disease. The risk of developing breast cancer is higher among those who have had a mother, aunt, sister, or grandmother with breast cancer before the age of 50. If only the mother or sister has breast cancer, the risk doubles. Having 2 first-degree relatives diagnosed increases your risk by up to 5 times the average. Although it is not known exactly what causes breast cancer, sometimes the culprit is a genetic mutation in one of the 2 genes, called BRCA1 and BRCA2. These genes usually protect against disease by producing proteins that protect against abnormal cell growth, but for women with the mutation, the lifetime risk of developing breast cancer can increase by as much as 80%, compared to 13% in the general population. In fact, more than 25% of women with breast cancer have a family history of the disease. For women without a family history of breast cancer, the risk is difficult to quantify. Estrogen is known to fuel many breast cancers, and several factors, diet, excess weight, and alcohol consumption, can raise estrogen levels in the body. The early signs of breast cancer include the following. Most of the time, a lump is detected that is usually single, firm and painless. Swelling of an area of the skin of the breast or under the armpit that has an unusual appearance. The veins on the surface of the skin become more prominent on a breast. The infected nipple becomes inverted, develops a rash, changes in skin texture, or secretions other than breast milk. A drop is found in an area of the breast surface. Types and stages of breast cancer. There are many different types of breast cancer. Some of them are fast-growing and unpredictable, while others develop slowly and steadily. Some are stimulated by estrogen levels in the body. Some of them are caused by a mutation in one of the 2 previously mentioned genes, BRCA1 and BRCA2. Ductal carcinoma in situ, DCIS. Generally divided into comedo, blackheads, the resected surface of the tumor is shown by the extrusion of dead, necrotic cancer cells similar to blackheads and non-comedo types. DCIS is an early breast cancer that is confined to the intraductal system. The distinction between comedo types and non-comedo types is important, as in situ comedone carcinomas generally behave more aggressively and areas of microscopic invasion may appear across the ductal wall into surrounding tissues. Ductal infiltration. This is the most common type of breast cancer, and it accounts for 78% of all malignancies. On a mammogram, these lesions can appear in 2 different shapes, stellate like a star or well-bound, round. Astrocytic lesions generally have a poor prognosis. Marrow cancer. This malignancy makes up 15% of breast cancers. These lesions are generally well restricted and may be difficult to distinguish from fibroadenomas by mammography or ultrasound. With this type of breast cancer, the prognostic markers for estrogen and progesterone receptors are negative 90% of the time. Medullary cancer usually has a better prognosis than other types of breast cancer. Lobular infiltration. Representing 15% of breast cancers, these lesions generally appear in the upper outer quadrant of the breast as light thickness and are difficult to diagnose by mammography. Lobular effusion can involve both breasts bilateral. Microscopically, these tumors show a linear array of cells and grow around ducts and lobules. Tubular cancer. It is described as an organized or well-differentiated cancer of the breast. These lesions make up about 2% of breast cancers. They have a satisfactory outlook with nearly 95% of a 10-year survival rate. Mucosal cancer. It accounts for 1 to 2% of breast cancer and has a favorable outlook. Usually these pests are well-bound, round. Inflammatory breast cancer. It is a particularly aggressive type of breast cancer that usually appears through changes in the skin of the breast including redness, erythema, thickening of the skin and protrusion of hair follicles that resemble an orange peel. The diagnosis is made by a skin biopsy, which reveals the presence of tumors in the lymph ducts and blood vessels about 50% of the time. What are the stages of breast cancer? The most common type of breast cancer is ductal carcinoma. It starts lining the ducts. Another type, called lobular carcinoma, arises in lobules. When cancer is found, a pathologist can determine the type of cancer, whether it started in the duct, or lobule, and whether it has invaded nearby invasive tissues in the breast. When cancer is detected, special laboratory tests are usually done on the tissues to find out more about the cancer. For example, tests for hormone receptors, estrogen and progesterone, can help determine whether hormones help cancer grow. If the test results show that hormones are affecting the growth of the cancer, a positive test result, then the cancer is more likely to respond to hormone therapy. This treatment deprives the cancer cells of estrogen. Other tests are sometimes done to help predict whether the cancer is likely to progress. For example, X-rays and other laboratory tests are performed. Sometimes, a sample of breast tissue is examined for a gene, known as human epidermal growth factor 2 receptor, HER2, which is associated with a higher risk of breast cancer recurrence. Special checks of the bones, liver or lungs are done because breast cancer may spread to these areas. A woman's treatment options depend on a number of factors. These factors include her age and menopause status, general health, size and location of the tumor and stage of cancer, lab test results, and the size of her chest. Certain features of the cancer cells are also taken into account, such as whether they depend on hormones to grow. In most cases, the most important factor is the stage of the disease. The stage depends on the size of the tumor and whether the cancer has spread. Below is a brief description of the stages of breast cancer and the treatments most used for each stage. Other treatments may sometimes be appropriate. Stage 0 breast cancer. Stage 0 is sometimes called a non-invasive or in situ carcinoma. Lobular carcinoma in situ, LCIS, refers to abnormal cells in the lining of the lobule. These abnormal cells rarely become invasive carcinomas. However, it is an indication of an increased risk of developing breast cancer in both breasts. LCIS treatment is a drug called tamoxifen, which can reduce the risk of developing breast cancer. The affected person may choose not to receive treatment, but to monitor the situation with regular checkups. Sometimes, a decision is made to have surgery to remove both breasts to try to prevent the cancer from developing. In most cases, it is not necessary to remove the underarm lymph nodes. Ductal carcinoma in situ, DCIS, refers to the abnormal cells in the duct lining. Ductal carcinoma is also called intraductal carcinoma. The abnormal cells have not spread outside the duct to invade the surrounding breast tissue. However, women with DCIS are at an increased risk of developing invasive breast cancer. Some women with DCIS undergo breast-sparing surgery followed by radiation therapy. Alternatively, they may choose to have a mastectomy, with or without breast reconstruction, plastic surgery, to reconstruct the breast. The lymph nodes under the armpit are not usually removed. Also, women with DCIS may want to talk to their doctor about tamoxifen to reduce the risk of developing invasive breast cancer. Stage 1 and 2 breast cancer. Stage 1 and Stage 2 are early stages of breast cancer where the cancer has spread beyond the lobe or duct and invaded adjacent tissues. Stage 1 means that the tumor is about an inch wide and that cancer cells have not spread outside the breast. Stage 2 breast cancer means one of the following. A lump in the breast is less than an inch wide and the cancer has spread to the lymph nodes under the arm. The lump ranges from 1 to 2 inches in size, with or without spread to the lymph nodes under the arm. The tumor is larger than 2 inches but has not spread to the lymph nodes under the arm. Treatment options for breast cancer in its early stages are breast preservation surgery followed by breast radiotherapy, and mastectomy, with or without breast reconstruction to rebuild the breast. These methods are equally effective in treating breast cancer in its early stages. Radiation therapy is sometimes also given after a mastectomy. Choosing a breast retention surgery or a mastectomy often depends on the size and location of the tumor, breast size, specific characteristics of the cancer, and how a person feels about breast preservation. With either method, the lymph nodes under the arm are usually removed. Chemotherapy and/or hormonal therapy is recommended after initial treatment with surgery or surgery and radiotherapy for stage 1 and most often for stage 2 breast cancer. This additional treatment is called adjuvant therapy. Systemic treatment is sometimes given to shrink a tumor before surgeries called neoadjuvant therapy. This is given to try to destroy any remaining cancer cells and to prevent the cancer from recurring or returning in the breast or elsewhere. Stage 4 breast cancer. Stage 4 is metastatic cancer. Cancer has spread beyond the breast and underarm lymph nodes to other parts of the body. The treatments for stage 4 breast cancer are chemotherapy and/or hormone therapy to destroy cancer cells and control the disease. The patient may undergo surgery or radiation therapy to control breast cancer. Radiation may also be helpful in controlling tumors in other parts of the body. Recurrent cancer. Recurrence of cancer means that the disease will return despite initial treatment. Even when a breast lump appears to have been removed or completely destroyed, the disease sometimes returns because undiscovered cancer cells have remained somewhere in the body after treatment. Most recurrences appear within the first 2 or 3 years after treatment, but breast cancer can recur several years later. Cancer that returns only in the surgical area is called local recurrence. If the disease returns to another part of the body, the return of the disease is called metastatic breast cancer. A patient may undergo one type of treatment or a combination of treatments for recurrent cancer. In the end, please activate the bell button, subscribe to the channel, to receive from us all that is new. For more information about breast cancer, please visit my own site. You will find the website link in the description. Thank you.